Hey everyone, this is Kaylin, and today I am presenting the Sjogren Syndrome Foundation and Sjogren Syndrome itself. So what is Sjogren Syndrome? It is a systemic autoimmune disease that affects the whole body. Symptoms include dryness of the eyes, chronic pain, and neuropathy. All of these are symptoms because we can't physically see it, and I also assume that for dryness of the eyes because the patient can just kind of complain about it. And then for the signs, dryness of the skin and tongue, we can actually see, dried skin, and I've seen the pictures of the dried tongue. It's not pretty. Lymphomas, which is cancer in your lymph nodes, and then major organ involvement that the Sjogren syndrome can actually manifest to and cause pain there as well. Diagnosis and treatment of this disease. So the diagnosis, the patient has to have the symptoms for at least 3 years. The website itself said 2.8. I just rounded up because that's basically 3 years. The clearest test for Sjogren syndrome is you have to get a blood test done, and they're looking for the autoantibody SSA. But if that's not present, it doesn't mean that you don't have Sjogren's. They can do another test if you have those symptoms that were present. So again, if they don't have the marker, they can take a lip biopsy. And if the lip biopsy comes back positive for Sjogren's, then they have Sjogren's. But a specialist is required for the lip biopsy. And 9 out of 10 women are more likely to, 9 out of 10 women are going to get the disease. And this is all out of 4 million people that actually get this disease every single year. So the treatment of this, there's actually no cure for this autoimmune disease, but what the patient can do is treat the signs and symptoms. So they can get eye drops for their dry eyes, which is one of the easiest ways, or get immunosuppressive medications to treat the manifestations of the internal organs. For the PTA implications, for the actual Sjogren's disease itself, the PT or PTA has to be careful with the patient, just like how older people have, fragile skin just because it's old skin. People with dry skin, they have to also be fragile as well because it's going to be uncomfortable, and I've had dry skin before, it bleeds easily. So you just have to have a lighter grip. And then fatigue is a very common symptom of Sjogren's disease. So if a patient is feeling fatigued, the PT or PTA must allow them to rest. A very common sub-disease that a person with Sjogren's disease can get is fibromyalgia. Most of the patients that have Sjogren's disease will get fibromyalgia. So what the PT or PTA does is help patient lessen their pain, which, going back to the slides for the PTA implications for my fibromyalgia, it's one of their goals is to decrease the pain of fibromyalgia. They can also do therapeutic exercises, and this includes stretching, aerobic conditioning, and aquatic therapy. And also, you don't want the patients to push through the pain. If the patient is feeling pain, you have to let them rest. Don't let them go on because it'll hurt them more in the long run. So the prognosis of this disease, there is no cure, like I said. So the patient can actually get lymphomas, again, which are the tumors, or the cancer, same thing. Infection of the parotid gland and tumors in the parotid gland. And then people with Sjogren's disease, if they have kids, they're putting their child at a greater risk of having lupus or a congenital heart block. So this is how a person with Sjogren's disease can get involved. They can attend a local support group. So the website for all 3 things that I'm going to talk about are all listed on this slide here. So the local support group, they are more than welcome to bring a friend, a family member, anyone that they feel safe with, or that they're comfortable talking about this disease with. And the support group just gives not only the patient with the disease, but the person that they bring along with them more information about the disease itself, and just gives the people a chance to meet other people with the disease. The Sjogren Syndrome Foundation has awareness walks throughout the year. The one that was coming up the closest actually got canceled due to the virus that's going around. But if you go onto the website, you can see all their future dates that they're having, and they're in many different states. And then people with Sjogren's disease can also participate in clinical trials. On the website, it shows all the places that the clinical trials occur, but you have to sign up for the email to get notifications for when they're actually going to be taking place. For more information on the foundation, I included the website here, their phone number, and their local call number. And I also included just the website that takes you to the contact page, so you can get the address and the fax number as well. And these are my references. So thank you guys so much for listening, and I hope you guys learn more about this disease and this foundation. Thanks, guys.